Mountain medicine. Hello and welcome to the channel. Living and working in Switzerland, I often find myself on a mountain. In fact, in Switzerland, one is never far from a mountain. Whether you live in a rural or built-up area, doesn't matter. Most people go up a mountain either for sport, hiking, biking, climbing or even gliding, or for some other hobby such as mushroom picking. Safe, edible ones, I mean, like the famous Steinpilz that one can pick in autumn in mountainous regions, or just for picnics to enjoy the view, for photography, fishing in a mountaintop lake, or just to enjoy a quiet moment of reflection in the solitude and majesty of the mountains. Needless to say, in whatever season you choose to visit a mountain, you have to be aware of the specific dangers. This video will be a quick one to highlight mountain dangers and to discuss medical issues related to high altitude. Mountain or high altitude medicine is a specialized field of medical science that deals with the health challenges faced by individuals when exposed to elevated altitudes, typically above 2,500 meters or 8,200 feet above sea level. As people venture into the mountains for mountaineering, trekking, skiing, or scientific exploration, understanding the physiological, environmental, and medical risks associated with high altitude environments becomes crucial. The lower air pressure and reduced oxygen levels at high altitudes trigger a range of physiological changes in the human body, which can lead to altitude sickness, hypoxia, low oxygen, and other life-threatening conditions. This video delves into the fundamental principles of mountain medicine, focusing on the challenges posed by high altitude, the diseases and conditions commonly encountered, the mechanisms of adaptation to altitude, and strategies to prevent and treat them should they occur. But before I even discuss physiological challenges, let's talk about the specific dangers of mountains, especially in winter. This has been triggered by my personal experience of mountain medicine. Every winter, my thoughts turn to a friend who sadly lost his life in the mountains of eastern Switzerland when he went out onto the mountains on his bike and simply never returned. Whether he was swept away in an avalanche or whether the weather suddenly changed and he succumbed to hypothermia is not clear. All we know is that his body was found months later, once the snow thawed. An unbearably tragic end to a life full of promise and potential. It is said by people brought up in mountain regions that there is no such thing as bad weather, just bad clothes. Whether it's a blazing hot summer or a freezing cold winter's day, it is important to bear in mind that mountain weather can change suddenly. It is not unknown for a snowstorm to happen in the Alps in mid-July. For instance, always be prepared is the motto for the keen mountain explorer. So, apart from avalanches and snowstorms, what else can go wrong on a mountain in, say, the Alps of Central Europe? Let's dive into the medical consequences of high altitude. At high altitudes, the body faces several physiological challenges, primarily due to reduced oxygen levels. Atmospheric pressure decreases as altitude increases, resulting in a lower partial pressure of oxygen. For example, at sea level, the partial pressure of oxygen is approximately 21% of the atmospheric pressure. But at 5,000 meters, it's reduced by half. This reduction in oxygen availability has profound effects on the human body. Hypoxia, or reduced oxygen availability in tissues of the body, is the most significant physiological challenge encountered at high altitudes. You would have noticed that in a plane, you have oxygen cannulas or masks available for when the pressure suddenly drops, for example, or just in general when there is any kind of emergency, because at high altitude you have lower oxygen levels. As the body attempts to adapt to this lower oxygen availability, several compensatory mechanisms come into play. The first is increased respiratory rate. You suddenly start to breathe faster. Now, this is just a compensatory mechanism by the body to increase the rate and depth of breathing to maximize oxygen intake. This is completely normal. Increased heart rate. The heart pumps more blood to improve oxygen delivery to tissues. And something called erythropoiesis happens, whereby the body increases the production of red blood cells to enhance oxygen carrying capacity. Your capillaries also dilate. This increases to improve the oxygen delivery at cellular level, whether it's in the skin or in the various organs of the body. This helps to simply make the oxygen delivery more efficient to the cells and tissues of the body. Acclimatization. Now, this happens over a period of days to weeks, so obviously for longer periods in high altitude areas, whereby the body gradually adjusts to high altitude conditions. This process includes production of more red blood cells, aided by the hormone erythropoietin. Now, some of you may know about this hormone. It is exactly the hormone that is often abused, that is often, shall we say, substituted at illegal levels by athletes, famously cyclists, who often have to cycle at high altitude. This process, whereby erythropoietin contributes to or promotes red blood cell production, obviously makes oxygen delivery more efficient, and therefore you can increase your fitness at high altitude. This process involves increased vascularization, so actual production of tissues and cells geared towards improving or making more efficient, shall we say, the production of new blood vessels, actually, in a process, slightly complicated process, which is called revascularization. This is a very, very elegant way in which the body actually creates new blood vessels to adapt to high altitude. It takes time. It's not something that happens immediately, but when it does happen, it improves exponentially the way that the body can provide more oxygen, more blood delivery to tissues. This in a parallel effort by the body in a process called enhanced mitochondrial efficiency in tissues also helps to improve the oxygen delivery. Basically, at high altitude, oxygen delivery is king. All the body's efforts are geared towards making this process more efficient. Otherwise, it's unfortunately not a good outcome. And we should dive into the consequences of poor oxygenation at high altitude in a minute. One other way that the body improves its likelihood of surviving at high altitude is by rehydration, and maintaining fluid balance. High altitude environments are often dry, and dehydration is a common problem due to several factors: the low humidity, cold temperatures, and increased respiratory rate contribute to fluid loss. Additionally, the body loses more water through breathing as the air is drier and colder at high elevations, high altitude, leading to evaporation from the respiratory tract, from your lungs and upper airways. This dehydration can exacerbate altitude sickness, impairs physical performance, and reduces the body's ability to acclimatize. It's critical to maintain fluid balance by drinking lots of water, adequate amount of water, even if the person does not feel thirsty. Basically, if you wait until you're thirsty, it's already too late. Now let's dive into what's known as high altitude illness. As a person ascends to higher altitudes, they may encounter various altitude-related illnesses. These illnesses range from mild symptoms to life-threatening conditions, depending on the altitude reached and the individual's rate of ascent, how quickly they go up. First, let's talk about acute mountain sickness, AMS. Acute mountain sickness is the most common condition that we encounter at altitudes above 2,500 meters. The symptoms include headache, nausea, dizziness, fatigue, and difficulty sleeping. AMS occurs due to hypoxia, low oxygen availability in the body, which leads to cerebral edema, basically swelling of the brain. The condition typically presents within hours of ascending to a higher altitude, especially if the ascent is rapid. Basically, in addition to the symptoms I've already mentioned, it's very common in acute mountain sickness for the patient to start getting confused when the swelling in their brain takes hold. The treatment for AMS is rest and acclimatization, nothing more. If symptoms persist or worsen, descending to a lower altitude is very important. In more severe cases, medications such as acetazolamide, which speeds up acclimatization, or dexamethasone, steroids to reduce brain swelling, can be deployed. Oxygen therapy is also beneficial if you have it. The next illness we're going to talk about is high altitude pulmonary edema. This is a severe form of altitude sickness that happens when fluid accumulates in the lungs, impairing oxygen exchange. This condition typically develops above 3,500 meters, but it can occur at lower altitudes in people who ascend rapidly or who do not acclimatize properly. It's essential to take time to acclimatize. This is advice given to mountaineers, explorers, for example, those who visit even the base level of Mount Everest. Not to talk about the mid-level or the very highest levels. It's very important to train physically, to train mentally, to try out different altitudes, basically do it so gradually and get the body used to the altitudes as you go up and not to do it suddenly. There are, in fact, training centers where you can practice, where you can test out your body, challenge your body before you do the real thing. At base level, I believe there are actual training centers based there for people who are doing it, for example, for the first time. The symptoms of high altitude pulmonary edema are shortness of breath, obviously, cough, sometimes with pink or frothy phlegm or sputum, chest tightness and fatigue. This is basically heart failure. The heart actually starts to show its weakness. It cannot cope with the low oxygen levels, especially as the body hasn't been given enough time to get used to this lower altitude. The pathophysiology of high altitude pulmonary edema results basically from what we call hypoxic pulmonary vasoconstriction. The little blood vessels of the lungs basically tighten up and squeeze up such that it increases the pulmonary artery pressure, the pressure within the lungs artery, the main artery of the lungs, and it leads to fluid leakage from the little capillaries into the little sacs where the air exchange actually takes place where you breathe. This impairs gas exchange, basically between oxygen and carbon dioxide, and can rapidly lead to a life-threatening respiratory failure. This is definitely a very, very unpleasant illness, and it's very, very easily avoidable if one takes the time to acclimatize properly. The treatment for high altitude pulmonary edema is basically immediate descent to a lower altitude and oxygen supplementation if you have it. Medications such as nifedipine, which is a calcium antagonist. It's a blood pressure medication, but it has other functions as well, where the wall of the blood vessels can be allowed to dilate, basically the opposite of vasoconstriction, and to allow for not only a slight decrease in the blood pressure so that you're not pumping blood from the heart against a high pressure, which is counterproductive, especially in the face of heart failure, and also the dilatation of that blood vessel or the blood vessels within the cardiovascular system reduces the pulmonary artery pressure as well, not just the systemic pressure, the blood pressure within the body's system against which the heart has to pump, but also specifically the artery pressure within the lungs. And this helps to reduce the awful symptom of shortness of breath at high altitude. Basically, patients often report that the feeling is that they're going to die. There's this very, very unpleasant feeling that you're about to die because the lungs are so restricted. They basically get so stiff because they're filled with fluid in the little sacs where gaseous exchange is taking place. The switch between intake of oxygen and expulsion of carbon dioxide, which happens organically as we breathe in and out. We're not even aware of this. But in the face of pulmonary edema at high altitude, the work of breathing suddenly exponentially increases such that every breath is quite an effort. Very, very unpleasant. Next up is high altitude cerebral edema. Now, this is a severe and life-threatening condition caused by swelling of the brain due to lack of oxygen. This condition typically develops at altitudes above 4,000 meters and is often preceded by AMS, acute mountain sickness, and or high altitude pulmonary edema. The symptoms of high altitude cerebral edema include severe headache, confusion, which I've mentioned before, difficulty walking, and lack of coordination, known medically as ataxia, hallucinations, and finally unconsciousness. And this, as you can imagine, in bad weather conditions up on the mountain, can very rapidly lead to hypothermia and rapid death. High altitude cerebral edema is thought to occur due to hypoxia-induced cerebral vasodilatation. Quite a mouthful. All that says is that the low oxygen causes the blood vessels within the brain to dilate, and this leads to fluid leakage into the brain tissue itself. The accumulation of fluid or water on the brain results in increased intracranial pressure, the pressure within the brain, within the skull, and this leads to the neurological symptoms that I have just mentioned, the difficulty walking, the lack of coordination, the headache, confusion, etc. Treatment is obviously immediate descent if that is a possibility. Otherwise, I'm afraid there is no coming back from this. Steroids such as dexamethasone can reduce the cerebral edema. Oxygen therapy is very, very good to alleviate the symptoms of hypoxia, and supportive care, basically, if it's possible to give a drip, if it's possible to give other medications that can help to drain off the fluid. Basically, the patient needs to be in some sort of medical center, even if it's a makeshift one at high altitude. Preferably, of course, at a lower level. So if you're in the mid-level of Mount Everest, for example, to descend to the base level. Finally, we discuss chronic mountain sickness. Now, this is also known as Monge's disease. It's a long-term condition that can affect individuals who have lived at high altitudes for extended periods. Chronic mountain sickness, or CMS, typically develops after many years of living at altitudes above 3,000 meters. It's characterized by symptoms like cyanosis, a bluish coloration of the skin due to lack of oxygen, but in a chronic manner, so over a long period of time, shortness of breath, fatigue, and reduced exercise tolerance. CMS is thought to result from excessive erythropoiesis, basically build-up or production of excessive red blood cells through the hormone we already talked about that is often abused by athletes, particularly cyclists, erythropoietin, and polycythemia or polycythemia, which is an abnormal increase in the number of red blood cells. This leads to thickened blood and reduced oxygen delivery to tissues. The condition is often associated with pulmonary hypertension and right-sided heart failure. As you know, the heart has two sides, left and right. The right is often, or is always, I should say, is always associated with the lungs. It's connected to the lungs. So problems within the right side of the heart is always caused by and results in lung problems. Treatment is descent to a lower altitude and phlebotomy, removal of blood, if it's possible to basically do phlebotomy at high altitude. It's the quickest way to reduce the number of red blood cells, to basically dilute the blood a little bit, to reduce the thickness of blood, the viscosity of blood. Medications like diuretics and vasodilators, medications that dilate the blood vessels, also help to manage the symptoms. Basically, the principles of acclimatization are as follows. Number one, gradual ascent. The most effective way to prevent altitude sickness is to ascend gradually, allowing the body time to adjust. A common guideline is the 500-meter rule, which recommends that a person not ascend more than 500 meters per day once they reach altitudes above 2,500 meters. Having lots of rest days, incorporating lots of pauses, regular intervals of rest, usually 3 to 4 days, allows the body to acclimatize gradually and enhance the oxygen carrying capacity of the blood. Hydration, we've already talked about. Proper hydration, drinking lots of water, is exceedingly important to prevent altitude sickness. Basically, 3 to 4 liters a day is typically recommended at high altitudes, so even more than at sea level. Nutrition is important as well. High altitude environments increase energy expenditure, as you would expect. So, in order to maintain physical strength, maintain the normal functioning of the body, it is recommended that one consumes a lot of fats and proteins, that in moderation, but carbohydrates are particularly useful, recommended to ensure that adequate energy levels are maintained. The medications for prevention, we've already talked about some of them. Acetazolamide, otherwise known as Diamox, is commonly used not only as a treatment but also sometimes as a preventive measure, especially for AMS, acute mountain sickness. Dexamethasone, the steroid, nifedipine, the blood pressure medication, which is also a vasodilator, are important in the repertoire of the mountain doctor. To conclude, high altitude medicine is essential for people who live at high altitude. It is important for visitors, for tourists, for weekend mountain enthusiasts to be aware of the dangers of mountain travel, mountain life, to be adequately dressed for the occasion, whether it's for windy conditions, for rain, for snow, for exceedingly hot weather as well. That's also important because at high altitude you often don't have cloud cover, and it's therefore important to protect your skin against burns, UV radiation, and obviously to prevent yourself from getting too hot and succumbing to heat stroke, for example. Very important to respect the weather, always watch out for the weather reports, and have the possibility to change your clothes to prepare yourself for the extreme heat and cold, for both, as the weather can change very suddenly in most mountain areas. This is something that often catches people by surprise, and given that in the mountain areas often phone networks are not particularly good, you have to be as well prepared as possible so that you have even less requirement to call in the emergency services. Have you often visited high altitude regions yourself? Do you have aspirations to do so? Perhaps to visit Mount Everest or Kilimanjaro once in your life? Would you dare to challenge your body to such a challenge? And it's not for the faint-hearted. Tell me all about your mountain medicine stories in the comment section below. I would love to hear it. If you have any questions, I shall be only too pleased to tackle them. Go on, Askadoc.